Good afternoon, everyone, and thank you all for being here. Let me acknowledge the leaders that are standing with me today. Of course, our Commissioner of Public Health, Dr. Allison Arwady, Gotham CEO, Matt Mickelson, and Dan Fulweiler, President and CEO of Esperanza Health Centers. In the past 8 months, we've learned a lot of incredibly important messages. And it's in this time of uncertainty that we must always find ways to remain prepared and to be proactive to address this challenge of our time presented by COVID-19. In the past 2 weeks alone, this has been especially important as our case rates have surged and more residents have become vulnerable to succumbing to COVID-19 or spreading it to someone else who is unable to fight it off. And as I said time and again, I've made it my priority to make sure that in everything that I do, we prioritize making sure that our residents are healthy and safe. And that's why in response to the second surge we're in right now, we've already undertaken a number of measures, including our most recent Protect Chicago strategy. A multifaceted, data-driven, and comprehensive effort includes personal behavioral changes and regulatory measures, all of which lead into our stay-at-home advisory that went into effect just a few days ago on Monday. And while we are confident in efficacy of the measures we've taken so far, our work is not done, especially considering that as the weather gets colder, more and more people will be spending time indoors, meaning we must prepare to see more positive cases. That's why today we're here to announce a new and enhanced community-based testing plan. Make no mistake, Chicago has and continues to break testing records. As a city, we are conducting over 16,000 tests per day and over 250,000 tests that have been conducted on our static or mobile city-run sites, which are directed into neighborhoods of the highest need. But the fact of the matter is that we can still do more to expand testing equity by ensuring this resource is available in communities that need it most. And that has really been our focus from day one. So let me talk to you about this new plan. And this plan covers 3 areas. First, we will be creating our 4th permanent testing site in a parking lot at Midway Airport. Starting Monday, November 23rd, this new site will be operational Tuesdays through Thursdays from 12 p.m. to 6 p.m. and on Saturdays from 10 a.m. to 4 p.m. and starting next week. With this site, we listened to the community that wanted more reliable options on the southwest side and wanted weekend availability for the first time. And we built on our ongoing efforts to drive resources where the resources are needed most. Second, we are announcing that we have directed $14 million in grants and other resources to help out our community healthcare centers. Though much of this funding will go into contact tracing, it will also be used to expand testing capabilities in our communities. And let me just say for a moment, off script, our FQACs have been tremendous partners throughout this pandemic, all year long. They are vital to our strategy in addressing COVID-19, and they have contributed to making sure that more people at the community level are connected up to care. And we just have to thank you again and again for the tremendous partnership that you have made with the city, and we're going to continue to do everything we can to drive resources to the FQACs. Our community health centers, which overwhelmingly serve our Latinx communities on our northwest and southwest sides, have played a huge role in making 100% accessible testing a reality. And this initiative has ensured that they are able to keep up this effort through partnerships with public health, the Chicago Cook Workforce Partnership, and City Colleges of Chicago, who have helped provide staffing support to these organizations and help them identify suitable community testing sites such as parks, schools, or libraries. And I want to give a special shout out and thanks to the Chicago Park District in its leadership through Mike Kelly, Chicago Public Schools in its leadership through Dr. Janice Jackson, and Chicago Public Libraries, who are always stepping up in a time of need, for helping make these sites available and further expand community-based testing across our city. Third, we are implementing a winterization plan to ensure that testing remains viable through the colder months. As part of this initiative, Curative has partnered with CDPH to provide vans for mobile testing, trailers to maintain drive-through testing operation, and kiosks to manage walk-up operations, allowing us to continue providing testing where it's needed the most, no matter the weather. And I want to, again, give a hearty thanks to Curative that came into our city several months back, has been an amazing partner for us and really helped us expand our horizons on testing and to allow us to target those communities that really need it the most. So thank you so much. Before I close, I want to take this moment to remind our residents that city testing sites are intended for the use by our most vulnerable residents. Meaning if you have access to a healthcare provider or medical insurance, please go there first. Your doctor or your health clinic, not a sitting testing center, is better equipped to help you if you have a positive test at this time. We want to make sure that for those people who unfortunately test positive, that you are connected up to a healthcare provider to help you manage a positive test, tell you what needs to get done, help you manage any symptoms, and make sure that you are well provided for. And today's announcement doesn't mean we should ease up on doing what works. So let me also remind you, again, we know that wearing a mask works. This is not about politics. It's about public health. So please keep wearing your mask, keep engaging in social distancing, and leave your home only for essential reasons, and make sure that you limit your contact with large crowds. I want to thank everyone that partnered with us on these new initiatives. With your collaboration and innovation, we will be able to continue a robust testing regime across the city to weather any storm. We're Chicagoans. We know how to manage weather, and we know how to manage cold. That won't stop us, and we will not stop in our continued efforts to meet this challenge of a lifetime. And with that, I welcome Dr. Arwady to the podium.
Thank you, Mayor. So I'm going to share a little bit of data and a little bit more detail about this plan. First, our COVID-19 testing in Chicago is at an all-time high. We are breaking records literally every day, and we need to be, given the way COVID is surging. As of today, we're averaging 16,259 tests per day across Chicago. Early October, as our second surge was starting, we were at approximately half that level, doing about 8,800 tests per day. If you look back to early June, we were doing about 5,000 tests per day. Our goal is to continue to grow this to meet this surge, and it is a multi-pronged approach that will get us there. There are many ways to get tested for COVID, and I encourage you to go to chi.gov/COVID testing to explore these options. First, as you heard the mayor say, if you have a healthcare provider, the best place to get tested is through that healthcare provider. They are growing capacity. They are the best point of contact if you do turn out to be positive, and that should be your first call. Secondly, at-home testing options continue to grow and expand. You can find information again on chi.gov/COVID testing, but these are now FDA-approved home testing possibilities. These are not the tests that people were remembering from the past with the very deep nasal swabs that were pretty uncomfortable. These are tests that involve a Q-tip in your nose, but not deep, a swab in your mouth, and we're going to see an example of the ones that we do through Curative at the city sites, or in some cases collecting saliva, spit, that you put into a tube. You collect it at home, you then send it in. We saw today that the FDA approved the first at-home rapid test. We'll be looking to learn more about that, making sure we're putting information on the website about how you can access that. But I want you to know that particularly if you have insurance, you are now able to get these at-home tests if you fill out a questionnaire and meet the qualifications with no initial cost to you up front. This is a good way for you to get testing in your home quickly. Next, pharmacies. Pharmacies continue to grow their footprint related to COVID testing, including pharmacies here in Chicago. It's not available everywhere yet, but increasingly we're seeing more of this available, and we're working with pharmacies to grow that. Next, our community health centers, our federally qualified health centers, as you heard, major partner in this space. They serve a lot of Chicagoans who are most in need of testing access and healthcare access overall. And then finally, the CDPH-funded community-based testing sites, which we operate in partnership with Curative and Gotham. This map here is from our website, chi.gov/COVID testing. You can go there. Every single one of those orange dots is a place that has public testing available. It's not all available all the time. You may need to do some follow-on, but I encourage you to explore what is near you and think about all the different ways that we can expand testing here in Chicago. Let's talk about the CDPH-funded testing, because as the mayor said, we have put equity at the center of our community-based testing strategy. As you know, COVID has been surging particularly in the northwest and southwest sides of Chicago over really going back to April, May, and throughout the summer. And so where we stood up testing, this has been no barrier testing. We directed every week to the areas of greatest need, wherever we're seeing surging cases, wherever we're seeing high positivity. We have our static sites that we are expanding, but we've had more than 165 mobile testing events week after week in the communities where it's been most needed. There have been more than 250,000 tests performed, and even the CDPH-funded community testing sites are doing about 3,300 tests per day now, up about 50% from what we were doing just a month ago. This map, the dark blue, shows the zip codes where people accessing the CDPH-funded community testing sites live. You can see we've had good success in terms of having folks from the areas of most need use our community-based testing sites. In addition, as you know, we've seen a lot of recent surges among Latinx Chicagoans in particular. And I do want to point out that while across the city, approximately 20% of the people who are getting tested report Latinx ethnicity, that is over 50% at the CDPH-funded sites. Again, that just has to do with us pushing tests where they are most needed. 30% of all people tested in the city are Black. But I also want to make the point that the CDPH-funded public health testing sites are a small piece of the testing that is happening in Chicago. You can see on this pie chart here from our most recent week, where were tests being ordered by providers and done in Chicago? And the largest category is actually other, which includes employers and home-based tests and lots of different operations around the city. But in terms of locations, our academic hospitals are still doing the most testing. We're working with them to expand that testing capacity, make sure community-based tests are being prioritized as much as possible. Next are these public health testing sites, but they're about 15% of the tests that are being done. We're looking to grow that, but we need to grow this whole pie. Private providers are next, and I encourage you, if you have a private provider, that's where you should go. Our community hospitals are playing an important role, as are our community health centers. Congregate settings, which would be our nursing homes, jail, et cetera, the health department's involved in that, but there's a lot of testing in those settings, of course, and then our pharmacies are rounding it out. And we look to see, where do we see the most positive tests? Where do we have the highest percent positivity? And that is, not surprisingly, at the public health sites, but it is also at our community health centers, and it is at our pharmacies. And so we're working to make sure the sites where people are getting tested the most often are getting connected to, for example, our capacity at academic hospitals. And then we're working with partners like Curative and Gotham to make sure we're not putting all of our eggs in one basket, so that we don't have turnaround times get so much longer here like we're seeing in other parts of the country. So we're trying to be strategic, work across all of these areas to quickly grow testing. As we are expanding testing in our community health centers, like Esperanza and the other federally qualified health centers, we have awarded $14 million in grants to help support case investigation and expansion of contact tracing. We also, Chicago Department of Public Health has recently distributed 40,000 rapid antigen tests to these same community health centers to build some more capacity for on-the-spot testing. It may need to be followed up with a more traditional test, but again, a way of expanding testing without adding costs to patients or to these centers. And then we're working on increasing staffing support. The city's testing sites, effective on Monday, will be at Charles A. Prosser Career Academy. We're moving from Prieto up on the northwest side. That's related to expecting that eventually here we do expect children back in school, and Prieto is an elementary school. So wanting to make that move, it remains in, it's a very good site with good access in the northwest side where we are most needing testing access. We are continuing operations at Maria Saucedo Scholastic Academy, continuing operations at Gately Park, and then, as you heard, adding a site at Midway Airport in the parking lot. This is not aimed for travelers. This is aimed for community members who live in 60629 and the surrounding areas. Obviously, that parking lot is well set up for being able to have significant drive-through. And then we will continue to deploy additional mobile units weekly. You'll hear a little more about winterization from our partners, but we are deploying vans for mobile testing in partnership with Curative, trailers to be able to maintain those drive-through operations, more kiosks. A lot of work's been done to think about what the winter is going to look like. But I do want to just finish by echoing the mayor. Testing only detects you once you have COVID. It is an important part of our strategy, but even more important are the things that we are doing to prevent COVID here in Chicago. When you are staying home, except for work, school, and other essential things, when you are not having individuals over into your home right now, when you're wearing your mask, when you're social distancing, these are the most important things that help us protect Chicago right now. We're going to continue to build testing capacity here. I'm excited about the new initiatives and how quickly this field is growing. But please do not confuse access to testing with thinking that you don't need to continue to do the things that protect us as a city. And with that, I'm really happy to bring up Matt Mickelson from Gotham Curative.
Thank you very much, Dr. Arwady. So I would like to recognize Mayor Lightfoot, her Chief of Staff, Maurice Clausen, Christina Anderson, CORE, also Dr. Arwady, as they recognized the need for testing and engaged with us very early on in the pandemic. They currently provide thousands of tests through Curative each day with a 24-hour turnaround time. We're reinvesting heavily in the city, providing 20 assets, including vans, trailers, and kiosks to continue that collection through the winter months. Giving you a little bit more background on Curative, in early March, a team of scientists, doctors, and military operatives came together, 7 of us, to create a solution and deploy a simple end-to-end product that would provide 24-hour PCR-based turnaround times with a simple oral swab. Today, we manufacture, assemble, distribute, administer, process, and report over 1 million tests per week across the United States. We're currently in 15 states. We're working with DOD. We're working with Congress. This is a real issue in our country. In the coming weeks, we believe will continue to diminish and gain velocity with this pandemic. So if we can provide anything at all to the city of Chicago as well as the country, we're here to help. Most importantly, what I'd like to do is I'd like to demonstrate our test to show everyone how easy it is and how painless and of a no-brainer it is. So at this point, I'm actually going to take the test kit. And in this kit, there's a number of products that we do manufacture, actually all in the United States, in Compton, California. We have our labs in San Dimas. In Washington, D.C., we built a lab that's the largest testing facility in the Western Hemisphere, processing 75,000 tests a day. We built that in partnership with DoD, Will Roper and the U.S. Air Force. And then we have a lab in Austin, Texas that we did with the emergency management department there. This kit, when you open the kit, there's different components of the kit. One component is a swab, and then you have the tube. In this tube, there's a solution that actually deactivates and kills the virus. So then after, when you're handling the virus and when it comes to our lab, the virus is deactivated there. So what you would do is, you'll stop, you'll actually cough in your arm 3 times. I'm gonna not actually do it in case, but we do test ourselves twice a day, but you cough in your arm. Okay. You'll take the swab, you'll then put the swab in your mouth, you'll swab yourself all around, under your tongue, roof of your mouth, 20 seconds, counting here. You'll then open the tube, you'll place the swab in the tube, you'll then put the swab, hit the cover on the tube, you'll then take the tube and put it in the bag. Everything is barcoded, so it anonymizes. So when you get to our lab, we're not identifying you as a person, we're identifying you by your barcode, and then we can report that way. Our results are reported over email and text directly to you, and we also do report to the health departments. This then goes and gets delivered to our lab via commercial air flights. So we actually deliver them directly every evening at the end of the testing day to O'Hare Airport. Well, then they're shipped directly to either Los Angeles or Washington, D.C., where then they're received by our team. From 7, today we have over 2,700 employees with 8,000 testing sites across the country. Our test has a FDA EUA, and by the way, the test that got approved today, we also invested in Lucera, and we think that has a lot of promise for at-home collection. So this is one solution, but that is another, and we're continue to diversify and offer more products. But with this, you'll then get your result. But while this is being processed, we ask that you go and you quarantine yourself and treat it as if it were positive until you have the result back, because if it does come back positive, then you'll go through the proper quarantine for the next 2 weeks, but it's very wise to do that. I'm happy to field any questions, but I think it's pretty much a no-brainer. There's no brain swabs or putting anything up your nose. I'd like to actually finish by saying Chicago is a city that I am not from, but it's very near and dear to my heart. As last year, my son began his college career, my eldest son, as a freshman at University of Chicago. So you can imagine how shocking it was halfway through his winter semester to be sent home from college. So we've overinvested in the city of Chicago, and we will continue to do that. More on a personal note from myself. So, and since then, we've actually purchased some real estate here in Chicago, and we really love Chicago, my family and myself. So thank you very much, Mayor and Doctor, for having us. And I'd also like to introduce Daniel Fulweiler from Esperanza Health Centers next.
Thank you.
Thank you very much. Thank you, Mayor, and thank you, Commissioner, for having me here today. My name is Dan Fulweiler. I'm the CEO of Esperanza Health Centers. We're a network of federally qualified health centers on the southwest side of Chicago in Brighton Park and Little Village. And we have been at the forefront of this pandemic since the beginning. We've done now over 17,000 COVID tests. Almost 5,000 of them have come up positive. And it has definitely been getting worse in the most recent surge. And I wanted to talk a little bit about that. The first wave of the pandemic hit our lower income, primarily Latino communities with particular severity. But now we're in a completely different place. Even when COVID numbers began to drop in the spring and summer, our positivity rates at Esperanza were consistently twice those of what they were citywide, showing how vulnerable our communities are to a major public health crisis like this. Now, with significant increase in new cases materializing in the neighborhoods we serve, it's clear that our communities are once again at increased risk, and we need to deploy additional resources for testing and treatment to reach even further into our community to serve our residents. In many ways, we're in a stronger position than we were earlier this year. We know now more about the virus and how it transmits from person to person. We've developed testing facilities and ever more effective protocols for screening patients. And we have an array of treatments that are helping to deliver better care to people who've been affected by COVID-19. But there are also challenges that make this second wave even more concerning for us in the healthcare field, and particularly people who are working in the healthcare field serving communities that are disproportionately affected. Just a few weeks into this second wave, our area hospitals on the southwest side are already experiencing ICU bed shortages. We were largely spared these kinds of shortages during the first wave of the pandemic, but if the trend of new cases continues the way it is, it'll be increasingly difficult for our sickest patients to receive the care that they need. The weather is another factor. It is Chicago, and we are used to the cold, but there are some things that really can't be done in the cold. Our testers are out there doing hundreds of tests every day, and we can't expect them to be out there in the cold. So we've worked on this really hard with help from the city, technical assistance. We actually have had several shipping containers delivered to our testing sites over the last week, which have heat and electricity in them and allow our staff to stay safe while they also stay warm while they're testing members of our community. But the cold also presents other problems, and this is one of the things that I'm particularly concerned about. As we move indoors, and especially in our Latino communities, we like to be en familia. We like to spend time with each other, and who can blame us? But that family time can be dangerous, especially when groups of extended families get together for holiday gatherings like Thanksgiving, La Dia de Acción de Gracias, and we really need to rethink the way that we celebrate these holidays. So I am asking everybody that they take extra care over the next couple months, that they limit their family gatherings to as small, just their immediate families, if possible. And I told my sister-in-law that she and my niece and nephew couldn't come over, and she was not very happy about it. But this is what's going to make it possible for us to get through the next couple months. At Esperanza, we went from doing about 100 tests a day to doing over 400 tests a day. And that sounds kind of simple, but actually it's a huge, heavy lift because we have to get additional people out there doing the tests. We have to find the swabs. We have to get the supplies. And if people weren't getting sick, we wouldn't have to do that work. So I'm really asking that people reconsider how they're maintaining their safety, wash their hands, wear their masks, stay away from your loved ones and your friends for a while, and just keep it really close. We're very excited to continue to work with this city on the new phase of testing that they're entering into. We have been cooperating with the Park District. We're going to be putting a mobile testing site in Marquette Park that's going to be open 6 days a week in starting about 2 weeks, perhaps 3 weeks. And when we get that up and running, we will be able to do over 500 tests a day at Esperanza. I want to finish by giving a heartfelt thank really to all the caregivers who are out there doing this testing. We talk a lot about the folks in the hospitals who are taking care of our sickest patients, but it's a lot of work to be out there all day, every day in the cold and in the sun and in the wind, treating patients, getting them the tests that they need, providing prescriptions to them in the street as well, and giving them really invaluable advice on how to stay safe. So a big shout out to them, our staff at Esperanza and all the other FQHCs across the city who are really stepping up. And then I just wanted to say a few words in Spanish for the Spanish media. Buenos días, yo soy Dan Fulweiler, soy el director de Esperanza Health Centers. Somos una clínica en el suroeste de Chicago, en Brighton Park y La Villita. Y como muchos de ustedes saben, estamos experienciando un problema muy grande con la pandemia, en que estamos surgiendo otra vez en la tasa de casos que tenemos. Este es un problema muy grande porque evidentemente nuestros doctores y enfermeras tienen mucha experiencia ya con esta enfermedad, pero solamente tenemos ciertos recursos para hacer todo lo que tenemos que hacer para mantener la comunidad salvo y sano. Estoy pidiendo con urgencia a todos ustedes que usen las mascarillas, que se cuidan en casa, que no salen de la casa ni si no tienen que hacerlo, y que lavan las manos y todas las cosas que estamos diciendo que tienen que hacer. En la comunidad latina estamos muy orgullosos de nuestras familias. Yo también soy orgullosa de mi familia, pero mi cuñada le acaba de decir que ya no puede traer a mis nietos a mi casa. Y eso me pone triste, y yo sé que pone triste a muchos de ustedes. Pero eso es algo que tenemos que hacer en las próximas semanas para que todos nos cuidamos muy bien y para que sobresalimos sobre esta pandemia. Entonces, cuídense todos, y gracias a la alcaldesa y a la comisionora para estar aquí con nosotros. Gracias. And I'll turn it over to the mayor for questions.
And before I take your questions, I just want to emphasize one other thing. You know, we announced last week that we were urging people to not have the traditional gatherings at Thanksgiving. Thanksgiving's certainly my favorite holiday, but we're asking families to keep it close, just in your household, which is really hard, and I recognize that. I would normally be welcoming my 92-year-old mother, who, you know when you're that age, you don't have as many days in front as you do behind. And it's going to be very, very difficult to be celebrating a holiday without her. But we've talked, and she understands and really told me it's not safe. I'm going to stay home. So we know that families all across the city and really all across the country are making those kinds of sacrifices to protect themselves and their loved ones, and we just urge people to do the same here in Chicago. And with that, I'm happy to take questions, or any of us are happy to take questions.
Thank you, Mayor. I got a number of questions that come in. First of all, one of the ones related to this, on topic with this testing, do you have any concerns that if people are doing all this additional testing, and they go out and get tested and they show up negative, that it may make them drop their guard for Thanksgiving?
There's always a concern about that, right? The diagnostic tests are a snapshot in time. And that's why we're encouraging people, and people are getting tested multiple times. You can't get tested once and think, I'm good for the duration of the pandemic. But I think it is important that people avail themselves of the testing resources that are out there, because the virus is incredibly persistent. We know, and we've talked a lot about asymptomatic spread. So it is important that people get tested and not be afraid of what the consequences are. And if I may indulge me, one of the things that I worry most about is essential workers who don't want to get tested because they're afraid of what they may find out, that are afraid that if they test positive, they can't go to work, that their employer may retaliate against them. And I just want to say what I've said before, the city stands here to protect you. And we want you to get tested. We want you to be healthy. And if you find that you test positive, it's essential that you stay home. And if you have any fears or concerns about what your rights are, please contact the city. The easiest way to do it is to call 311, but you can also go to the city's website, and we can provide you with the information you need to make sure that you will not be retaliated against, that your job will be secure, because everyone who is sick with COVID needs to stay home. They need to quarantine. They need to follow the public health advice, and they don't need to worry about whether or not their job is going to be there for them, because they're doing the right thing for themselves, their families, and their communities.
A number of questions regarding your school announcement yesterday that you sent out in a press release. One we've heard several about is, with the governor announcing the Tier 1 restrictions going into place, you're announcing that kids are going to be going back into school. Are you concerned about the mixed messaging there, with the state tightening up, and you're talking about going back to school?
Yeah, but if you look at the governor's announcement, he specifically did not place any restrictions whatsoever on schools, and really left that to individual school districts to make that call. I've said this before, and I'll say it again, and I may invite Dr. Arwady up to also respond to this question. We're obviously doing everything we can to keep every resident safe. And of course, that includes our young people. And we have taken a significant amount of steps over these last few months to make sure that the protections on a classroom by classroom basis are there, so that when it's appropriate for students to return, that they're going to be returning to classrooms and to school buildings that have the highest level of protections against COVID-19 that we can possibly muster. And what I know from spending a lot of time talking with Dr. Jackson, Dr. McDade, Dr. Arwady, and looking at the literature of studies that have been done across the world, and also knowing what the experience is of 40,000 kids that are in other school systems here in Chicago, is that schools, if those mitigation efforts are taken, are actually quite safe. And first and foremost for me, protecting our children, but also this is truly a matter of equity. We know that remote learning works well for some, where there is an adult in the home that can help the student with the basics, logging on, answering any questions, help support the classroom learning, but also the homework that has to be done. Unfortunately, that is not the experience of some of our children. And for some of our children, particularly our youngest learners, and also our kids with special needs, school is more than just a place where they go and learn reading and writing and arithmetic. School is a place where they get social, emotional learning, where they bond with their peers and their teachers, where they get other supports like an IEP, an aid that helps them with their learning, where they get health care in the school system. So for those students, you cannot replicate those kinds of crucial in-person supports by looking at a Zoom screen. It's just not going to happen. And so we need to make sure that, consistent with the public health mandates, that we are building a pathway for those kids to get back into the classroom. And obviously, there's been a lot of conversation with everybody in the school environment, teachers, building principals, staff, that goes into this decision. But fundamentally, we cannot afford to have those students fall behind. And for those parents who feel comfortable, they're going to send their kids back. For those parents who do not, they have an opt-out. But we've got to build a pathway for our students to get back into in-person learning, because there is absolutely no substitute.
Is there a plan for high school students coming out? Is there a plan for high school students?
We're going to start, obviously, gradually in the way that CPS announced yesterday, and we'll look at high school students in the new year.
A couple of questions regarding the Finance Committee today from my colleagues, wondering your reaction to this, and do you expect that you could end up having to be, as the president of the council, the deciding vote if there's a 25 to 25 deadlock?
Well, look, let me first say I want to thank the aldermen who voted to support the budget. I tell you, the Finance Committee. We've done a lot of work over these past couple of weeks, in particular, of working hard, listening to our colleagues in City Council, listening to our partners in organized labor, and the changes that have been made to the budget over time really reflect that listening, that learning, and that partnership. So I am grateful for those who stepped up today and voted. The other thing I also want to say is this. You know, there's been this notion in reporting that the mayor's budget, let me be very clear about this. This is not my budget. This is a budget for the people. This is a budget for funding some of the things that we are talking about today. The needs in our community, particularly in this year, are so great that we have to rise to the occasion and meet the challenges that this very difficult year has presented. And I think members of the City Council understand that. And I think the vote today certainly reflects that understanding. And so I am grateful. We take nothing for granted. We have another committee hearing tomorrow, the Budget Committee, and then next week, the final vote, if we are fortunate enough to pass the ordinances that are going to be in front of the Budget Committee tomorrow. So we're going to continue to work hard. We're going to continue to listen to our partners in the City Council. Our residents expect us to lead. They expect us to step up. and make the hard decisions, particularly in difficult times like these. And so we are going to continue to work hard to earn the trust of our residents and work every single day on the behalf of the great people of this city.
Do you think you'll get 30 votes? Do you think you might need?
I'm not going to speculate. As I said, we take nothing for granted, and we're going to continue to work hard.
Last two questions.
There is a question about Chicago Public Libraries. They are open. The question is, how safe are these facilities during the surge? Because that concern has been raised.
Yeah, great question. Extraordinarily safe. Before we brought librarians back in June, we spent a lot of time talking to them, talking to the commissioner and the leadership at the library to make sure that the librarians and the staff who were working in the libraries had everything that they needed to be safe. So the libraries have been back open since June, I think with good success. But we continue to listen, and we continue to look for ways that if there is, we need to adjust and take additional precautions in the libraries. We've done that. But I think if you go into a library, you're going to see the staff is super professional. Really on top of things, making sure that the libraries themselves are clean, that they're engaged in social distancing, tons of signage, lots of work to put a lot of programming virtually. I actually participated in a virtual book group last night, but I got to give hats off to the library team, and particularly the individual librarians and the branch managers, because they've done a tremendous job.
Last question.
If I could get two, maybe. This one came in earlier today. Brett Chase with the Sun-Times asking, how are you going to respond to the request from HUD, which has asked the city to put the general iron permit on hold during this federal investigation?
Well, there's obviously ongoing litigation, and as always, I never talk about ongoing litigation. The lawyers will handle that, and we will be providing a response to HUD in due time.
Final question.
Will you put the permitting on hold, I guess is what he was trying to get.
As I said, we will be responding to HUD, and we will do that in due time, but I'm not going to talk about the particulars of ongoing litigation.
Final question, Craig.
Just going back through these series of emails, I guess the one I haven't touched on, off topic here, with the cases surging, are you regretting the decision to, shut down McCormick Place? And I realize this was not taxpayer money, but this was federal money. But is there some regret with that now that we may need it again?
No, it was appropriate at the time, and it wound down back in June when we were seeing a decline in cases. But as you may recall, there were other facilities that were stood up, and should the need arise, for example, Metro South is ready to go in the event that that's necessary. My hope is that we won't see a kind of surge in cases, and I'm mindful of the fact that every hospital is different, but we and Dr. Arwady and her team are in regular contact with the hospital CEOs and medical directors, and we're looking literally multiple times a day at what the case count looks like, both in terms of hospitalizations and ICU beds, but in partnership with the state, we have a plan in the event that that's necessary.
Thank you, Mayor. Thank you, Craig.
Okay.